Bore da, croeso I bawb. Welcome to today's meeting of Powys Teaching Health Board. We are holding the meeting virtually and it is being streamed live via the Health Board's website. It will be also available to view after the event. First, I'd like to welcome any members of the public or the press who are viewing the meeting, and a welcome to, of course, the board members, representatives from the Community Health Council, and any observers who might be present. I will introduce the participants myself, as this is a virtual meeting, and I suppose I need to start with myself, although it's not very polite, I suppose. I'm Vivian Harpwood, Chair of Powys Teaching Health Board. Also present are Melanie Davis, Vice Chair of the Board, and independent members Francis Gerard, Ian Phillips, Mark Taylor, Susan Newport, Trish Buchan and Tony Thomas. Then the exec team, we have Carol Shilbier, Chief Executive, and the following executive directors present: Jamie Marchant, Deputy Chief Executive and Director of Primary Community Care and Mental Health; Julie Rolls, Director of Workforce and Organisational Development; Hayley Thomas, Director of Planning and Performance; Alison Davis, Director of Nursing; Claire Madston, Director of Therapies and Health Sciences; and Pete Hopgood, Director of Finance. Also Paul Buss, very big welcome to you, Paul, as our interim medical director, kindly helping us out. Also present is our board secretary, of course, Rani Mallison, and Katie Blackburn, Chief Officer of the Community Health Council, and colleagues from corporate governance from the team who will be supporting the meeting. We've received apologies from Stuart Bourne, Director of Public Health, and Francis Hunt from the Community Health Council, and finally Matthew Dorrance, one of our independent members. Please note that participants may look away from the screen from time to time when presenting to enable them to access documents, and bear with us on that, please. Moving now to the agenda, which is published on the website along with the papers. The first item you will see there is the welcome and apologies. The second item, I will ask if there are any declarations of interest. No? Thank you. Then we can proceed with the minutes of the previous meeting, which was held on the 29th of July, for correction, if there are any, and approval. So if you could turn to those, please, those members present, and can I ask you whether you spotted anything in these minutes which requires correction, any matters of inaccuracy? I think Katie may have a comment on that. Is that right, Katie?
Yes, thank you, Chair. Thank you, Chair. Could I just comment on page 17, on the third line, the minute should read visiting activities. I hope it's evident from all our reports that Powys CHC has actually been incredibly busy during this period. And then further down that paragraph, we've not held meetings in public. I think that's really important to say. We have been meeting on a regular basis. And on page 18, if we could remove slightly, because I think it's fair to say at the date that this meeting took place, members were extremely concerned by the situation.
Right, thank you.
Thank you.
And Trish, you had a comment, I think, a suggestion.
Yes, if we could go to page 5, third paragraph down, item 2039. I think there's an error. It suggests that there are approximately 4 pathways that need to be looked at in line with the original plan. I understood there were more than 4 pathways that we were considering.
Carol, can you can you help with that?
Yes, thanks very much for that. I think a bit further in that paragraph, it refers to 47. So I think there may well be a missing number against the 4. There are 4 key care groups, but 47 pathways.
Thank you.
Okay, thank you.
Definitely more than 4, so thank you, Trish. Does anybody else have a comment? Okay, I can't see anyone. I'm not sure whether Paul Buss has a comment. If not, can I be confident that these are accurate minutes, that this is an accurate record of that meeting? Thank you. Are there any matters arising? No? I also understand that there are no outstanding actions, which is good. So, thank you. Before we leave that, I will just summarise briefly the in-committee session that we held on the 29th of July. This is just to note, there was a discussion following the board meeting in private. Obviously, we are committed to transparency and openness as far as we can, but occasionally the law requires us to respect confidentiality of patients and staff, and there are some things that can't be discussed in public, and actually the legal framework around this is extremely complex, so we are careful. But briefly, we did have a short meeting in private session to discuss the Health Board's commissioning arrangements with Shrewsbury and Telford Hospitals NHS Trust. And it was agreed that this really needed to be discussed separately from the main board because of sensitivities at the time, and we need to be very mindful of that. No formal decisions were taken at the meeting. The Chief Executive's report today includes an update on that position. So that was the only item that we discussed at that meeting. So I don't know if there's anything else anybody wanted to add at that point. Thank you. I will then go on to present my own update report. And to first of all reiterate that we are committed to openness and transparency, and the conduct of our business, as far as possible, should be in public session for everyone who wants to observe to do so. But in the light of COVID-19, obviously we've introduced this live streaming, which makes it rather more difficult for people to participate in some respects. But in other respects, it absolutely is more inclusive because members of the public, our patients and staff can watch from their own premises without having to travel to Brontleys to attend the meeting. We continue to keep our governance arrangements under review as we respond to the pandemic to ensure that our arrangements are all appropriate and proportionate. It's a particularly busy time for the Health Board, as I'm sure you realise, and I'd like to extend my thanks to all the staff who are so valuable to us, but also to our wonderful partners, because we've been working collaboratively with so many partners over the last few months, and we may not all agree about everything all the time, but we do try to collaborate as best we can. And luckily, fortunately, we all have the same common goal, which is to act in the best interests of the population of Powys. So thank you, everybody. And, you know, we know that this situation of lockdown and difficulties, partial lockdown, fortunately not full lockdown for Powys, is not going to go away. Only last night, Mark Drakeford on television warned us that Christmas will not be the same this year. So this is an indication that we all need to be adapting all our personal lives as well as our work commitments to the new world around us. The Chief Executive's report, which will follow next, provides considerable detail about the position of Powys Health Board and all our efforts to maintain business as usual. So I'm not going to go into that sort of detail, but I would say that when she first joined us, Carol Shilby as Chief Exec, she described our relationships with our partners as spaghetti hoops. Now they appear to me to be more like a giant spider's web, because not only do we have those relationships, we also have a whole raft of very complex legislation through the Coronavirus Act and the regulations made under it, as well as the difficulties posed by the pandemic. One final point is I would like the board to be aware that we're holding 2 independent member vacancies. We've been working closely with Public Bodies Unit, and we anticipate being able to advertise these positions in October 2020. Both roles will have a generic profile rather than a specific profile. And I would like to thank Owen James, who served with us as an independent member for several years, for his commitment to Powys, to the people of Powys, and to the Health Board. So if he's listening, thank you very much, Owen. So that is the end of my report, and I'll hand over now to Vice Chair Melanie Davis to present hers.
Good morning. Thank you, Chair. I won't be overly long with my report. There's a few points I'd like to touch down on. I indeed was going to highlight the partnership work. I think we will all be wanting to sort of focus on that and how well that's worked for Powys. I'm very aware that we've had our joint partnership board with the local authority. We've had our Start Well boards, the regional partnership board, which I'm sure our Chief Exec will go into more detail. But I'd also like just to draw to attention a meeting that was held yesterday, which I'm aware that the Minister attended as well, with Claire Swales from Pavo, and she chaired that meeting on an All Wales meeting about just how much work the community connectors throughout Wales have been doing during the COVID period. So I thought I'd highlight that just as an example, because I know Claire has been really forging ahead with that from her work in Pavo. I'd just also say very briefly, I've attended the Radnor and Brecon CHC meeting in South Powys earlier this month. That was a very interesting committee. A lot of concern about the South Powys work, you know, and the South Wales work going across, and that's a conversation we'll be having today. Welsh Health Specialist Services I've touched base with as well. They did their annual self-assessment and asked all the chairs of EQ&S to attend a meeting to go through that work. So we have a fuller understanding working with the quality and safety remit. And I think really I could leave it there almost. It was really just a very quick update. EQ&S committee is tomorrow, as is my ministerial meeting, so it's come a bit late for board today, but we are definitely going to be focusing on our winter plans with the minister meeting, I know. So if I could leave it there unless there are any questions. Thank you, Chair.
Thank you, Melanie. Are there any questions for her? No, well, if not, I'd like to bring Carol Shilby, our Chief Executive, in to present her report.
Thank you very much, Chair, Borodar, to everyone, and delighted to present my report. It has been circulated as part of the papers for this morning's meeting. And there are a couple of areas that I'd wish to just draw out. One relates to the provision of services during the pandemic, and we will have a presentation a little bit later on in the meeting about the preparations for winter, comprehensive preparations, and as the Chair and the Vice Chair have just referred, we are working with partners and a significant number of partners to ensure that we're as well placed as we can possibly be for what is likely to be a very challenging winter. We are progressing well within Powys, and although the numbers of cases rise and fall, we have been able to maintain a position where we're not in a level of local escalation and lockdown, but of course that, as we know, can change very quickly. There have been challenges really around testing, which is very well known and being covered widely in the media. But I would say that just 2 weeks ago, we have reached our highest level of testing than we had through all of the pandemic. So testing remains a really critical part of our prevention and response. And the positivity rate, again, is low. So they're important indicators about whether we are testing sufficient people. We are working very well with Powys County Council on the tracing part and very high rates of contact, so we can be confident of that at this stage. And we are looking at the resourcing to increase the numbers of contact tracing colleagues in order to deal with any further increases in demand. And then finally, we are planning ahead for mass vaccination. We don't yet know when a vaccination will become available, but it is really, really key that we can prepare as much as we can. So as soon as we're given the green light, we will be looking to implement our vaccination plans, and I'm sure we're all looking forward to that. The next item I just wanted to raise attention to was one that was discussed in a private session following the last board meeting, and that relates to Shrewsbury and Telford Hospitals NHS Trust. As many board members will be more than familiar with, the trust crossing Shrewsbury and Telford does provide a significant amount of care for people from the North Powys or the Montgomeryshire area, and some parts of Radnorshire as well. So this is a strategically important provider for us, and we are very well aware of the difficulties in Shrewsbury and Telford and the latest Care Quality Commission reports, and there are links in my report to the detail of those. We have been working with a number of key stakeholders, system stakeholders, so the CQC themselves, NHS England and Improvement, the CCGs across in Shropshire and Telford and Wrekin, and others, and we were really pleased to see that an improvement alliance has now been formed between University Hospitals Birmingham and Shrewsbury and Telford. I think that presents a real opportunity to support Shrewsbury and Telford Hospital to provide improved care. I've outlined the key areas of the CQC's findings, so it is those areas and others that will be the focus of the Improvement Alliance, and we will have very regular contact with the University Hospitals Birmingham. I've personally had a meeting with the Chief Executive there, and we will be maintaining close contact on that. We are developing a risk balanced plan in Powys, just to try to ensure that we're doing all we can as both a commissioner and a provider of care for the whole pathway for people in Montgomeryshire. So I just wanted to bring that sort of public focus to the work that we're doing there. And then finally, Chair, I've included a summary against the key strategic priorities that we agreed at the last board. Clearly, we set out at the start of the year in January by approving our integrated medium-term plan for submission to government without, even fully understanding, of course, that we would not be able to progress many elements of that plan. However, I think our reassessment of the strategic priorities have helped us to maintain a focus on those things that we really must drive forward. So I hope that that update in that part of the paper has been useful. There are some items that will continue to come forward in the next few months, and there are some items on today's board agenda that relate to the strategic priorities as well. So we will be covering off a number of those elements during the meeting. So I thought I'd just leave that there, Chair. I'm very happy to take any comments and questions on my report.
Right, thank you. That last section I found really helpful, actually, very clear. Thank you. Ian, you have a question.
Thanks, Chair. Just a couple of things, if I may. First of all, I think just to commend the management of the specific incidents, as you mentioned in your report, Carol, that we, are in a fortunate position in Powys, and just to commend colleagues for the management of those specific outbreaks has been really helpful for us. Couple of questions in terms of prevention and the vaccination. First of all, the prevention plans, are those going to come up later on? Okay, so I'll hold that till later. And just a comment on one comment and a point of clarification. In terms of the vaccination plans and mechanisms that we're developing them, and I was just reflecting on the importance of folk getting their flu vaccinations this year. Are we likely to use those enhanced methods that we're developing to, attack the flu, the take up of the flu vaccination this year? Shall I pause there before I ask? There's one final thing I'd like to ask.
Yeah, thanks very much, Ian. I think this is a really hot topic at the moment because we are absolutely in the flu campaign season, and what we've found from other places, particularly in Australia, for example, is that the uptake has been really good, and we're hoping to encourage that as well. It is complicated because there's what I would say is the traditional flu approach. And then the government have widened some of the categories. So there's a age 50 to 64 age group now, which is an additional category for this year. We are working through with general practices what they're able to do practically in terms of administering the flu vaccination programme, both in terms of the core programme and then any additional programme. And so, I suspect, Ian, we will end up with a slightly hybrid model. We are going to have to try to be really clear with the public, and I have had a couple of inquiries already because the programme is quite complex at this stage. So we're currently working that through, and we will need to do some communication out to the public to help people to navigate that system.
Thanks for that, Carol. My final point is more of a question and a point of clarification, really, and relates to Shrewsbury and Telford. I think I know the answer to this, but I think it would be helpful for those that perhaps haven't got the history to know the answer. Just wanted to confirm the timelines of the University of Health Board of Birmingham coming in, because it didn't appear completely clear to me. I had a question in my mind. That was post the quality the CQC reports. I just wanted to make that clear, really, for folk that perhaps haven't been through the history. That is the case, isn't it? That Birmingham were appointed in their advisory / helpful role following the CQC reports.
Yeah, thanks, Ian. I think the announcement of the New Improvement Alliance was made in the same week that the CQC reports were published. So it is an intervention as a result of the very difficult and very worrying CQC findings. Yeah.
Thank you. I can't see anybody else who's wanting to ask a question. So thank you very much, Carol. We'll now move on to the next section. That's section 2.1, the annual report for 2019 to 20. And I think you're going to introduce and speak to this, Carol. We have asked to receive and ratify this report. So over to you.
Yes, thanks very much, Chair, for this. It perhaps gives me an opportunity to plug our annual general meeting, which will be taking place at the end of October. And as we're getting to grips with live streaming and the new way of using technology, I am hoping that we will have people able to join us for our annual general meeting through digital means. Over the last few years, we have always looked forward to our AGMs because our partners, our key stakeholders have come in pretty significant numbers to discuss with us really key matters relating to health and well-being. So a bit of a plug there for people, and there'll be details about how to participate in that meeting on our website. But in terms of the annual report, colleagues, you'll see that this was approved by Chair's action on the 25th of August. So therefore we are looking for ratification of that approval. And it was approved because it did need to be submitted by the end of August to the Welsh Government. In terms of the report itself, we have had previous reports just over the last few months in relation to, for example, the part 2, which is the accountability report, and the part 3, which is the financial statement. So they will be familiar to you, and I won't go back over those. But this is really relating to part 1, the performance report. And again, it feels very slightly strange actually to be presenting last year's report now whilst we are in the midst of the global pandemic, because really so much has changed, and we will be, of course, really thinking about what has changed, almost for the better, if you like, and those areas where we would not wish to sort of step back into previous ways of working. But in terms of the report itself, I think at summary level, the last year, so 2019 to 2020, was a good year for the Health Board in terms of having an approved integrated medium-term plan and the performance against that plan. I won't go through specific detail, apart from saying that we can see that there's been progress made in each part of our IMTP areas, our health and care strategy. In particular, good progress around areas such as focusing on well-being, which of course is getting even more of a spotlight during the pandemic. Early help and support, and in particular the developments of the primary care clusters, and some more of the work that has been committed to within the cluster IMTP plans, and also in terms of tackling the big four. So we will receive in due course the Partnership Mental Health report, but I would just draw out the work that's been happening on respiratory care, and again, you know, the impact that should have in relation to this year and COVID. I think I'll just leave it there, Chair. The report, I hope, is reasonably easy to access, but there will be a PowerPoint presentation with a speakover ready for the annual general meeting, and I hope that that will be widely accessed by members of the public, as well as board and staff members. So very happy to take any questions on the annual report. And I think we are looking for the board to also ratify the Chair's action.
Yes, thank you, Carol. And given that there are 241 pages in this report, I think it's a good idea that we will be having a proper PowerPoint presentation to help us through it. But thank you very much. I can't see anybody wanting to ask a question about it. Now is your chance if you do have a question. No? If not, can I ask everybody to ratify this? Thank you very much. Thanks. Well, we need then to go to the next item in this section, which Alison Davis, our Director of Nursing and Midwifery, will be speaking to. That's our annual quality statement, also extremely important for us.
Diolch, Chair, bore da everyone, and thank you very much for the opportunity to bring the annual quality statement to board for approval this morning and subsequent publication following approval. The annual quality statement is a requirement by Welsh Government. It fits in very neatly with the annual report and a number of the other strategic drivers for the Health Board during the previous year. This is the 7th annual quality report, and you will note from the paper that the report, the AQS, has been developed in accordance with the Welsh Health Circular that came out in December 2019, identifying some minor changes to the overall approach to the annual quality statement. Our internal audit review has been undertaken, and the results of the internal audit will be formalised with us soon, documented slightly later in the paper. So for board members and others who recall, the annual quality statement has an element of looking back over the previous year and also looking forward to the forthcoming year, to some of the strategic drivers the Health Board would like to achieve. So this year's AQS, it's been developed with the involvement of services. It's been centrally coordinated. Members will note from the report by internal audit that there has been some change to the way in which the AQS has been approached this year, mainly due to the effects of the pandemic and some of the stepping down of usual arrangements during the first phase. The fieldwork undertaken by internal audit has shown that the sample of information is consistent with the Welsh Health Circular requirements, and their recommendation mirrors that made of last year in terms of the process going forward in making sure the AQS is achieves maximum involvement and is very well informed by the time that it's completed. So the previous recommendation made by internal audit will stand for this year. If I can just draw members' attention, please, to some of the good examples of the achievements made during the last year, and also to the forward look, which equates to implementation of our clinical quality framework, and also embracing the Health and Social Care Quality and Engagement Bill requirements going forward in terms of transparency, duty of conduct, etc. So we're expecting there may be some change to the way in which we report quality in forthcoming years. And there's a Welsh translation available of the annual quality statement, and it's been proofed in terms of accessibility. So we're hopeful that the AQS is a very good example of us demonstrating the quality of our services over the last year. I'm happy to take any queries or comments, Chair.
Thank you, Alison. I can see that a huge amount of work has gone into this, so thank you to you and the team. I can see Trish has a question. Trish Buckman, independent member.
Hello, thank you. Thank you for the report. I'd like in the first place to commend the report, but particularly the work that was done under infection control and prevention, which has stood us in good stead most recently, but also the work of the hydration and nutrition strategy. There's some really good progress that we've made there. Finally, looking forward, I think it is important that we look at goal 1, looking at our model of clinical quality framework, so that we can make sure that the work that we do going forward ties in with the areas that we're most at risk and where we need to do most improvement. But thank you for the work that you and your team have done during this time.
Thank you very much indeed.
Thank you. I can't see anybody else wanting to ask a question. So can I just ask everybody if you're happy? Oh, I can see somebody does want to comment, but I'm not quite sure who that is. I think it's Melanie Davis. Mel, would you like to come in?
Thank you, Chair. It's just to thank the amount of work that's gone into it under the circumstances. Really, I'm just echoing Trish, and I would leave it, but I think it's necessary to say it. But it does make a difference to us, so it's just marking that down. Really, thank you.
Thank you very much. Thanks. In that case, can I ask everyone if you're happy to approve this report for publication?
Yes.
Right. Thank you. I'll take that as a yes. Thank you very much, Alison. And now it's Claire Marsden, Director of Therapies and Health Science, who's going to present a report on the Welsh language, also very important.
Thank you, Chair, and thank you for the opportunity to bring the Welsh Language Standards Annual Report for ratification and for note today. So the purpose of this paper is to seek approval of the annual monitoring report, which, as you can see, we're cutting to the wire today. We've got to actually publish it today. So that will be my job as soon as this is finished. This is actually the first of its kind since the introduction of the standards for healthcare sector bodies in May 2019. And we have a very specific template with which we complete this form, which is the reason it's laid out in the way that it is. So this outlines the progress we've made against the 121 standards throughout 2019 to 20. And it also highlights the areas where we've managed to do a lot of work and have significant progress, but it also outlines the additional work we have yet to do. So I think it's fairly clearly laid out, so I don't have anything further to say. So I'd like to open up for questions if anyone has any.
Thank you, Claire. I can see that a lot of progress has been made, but there are still some red blocks there. But, you know, given the difficulties in which we are all working at the moment, that's great. Thank you. Are there any questions or comments, please? No? If not, then I'd like you to ratify this, and just in time, I'm glad to say. Everybody happy? Thank you. Thank you very much. That brings us to the next section, 2.2, and I'd like to bring in Hayley, Director of Planning and Performance, who will start us off on this section of the agenda. Some really important issues here as well, and interesting for any members of the public who might be listening.
Thank you, Chair. Diolch yn fawr. The Innovative Environments Interim Framework has been pulled together in light of the fact that during this last period, we've had to redirect a lot of our attention to responding to the pandemic in terms of the changes we've needed to put in place in the built environment. The Innovative Environments is an interim framework for the board to consider in relation to understanding how the suite of various business cases and capital developments that will be coming through this today, a little bit later, the broader V case, as well as other proposals over the next sort of couple of months. It's really
Hayley, I think your mic is off for some reason.
Sorry, Chair, I'm not sure what happened there. Did you hear anything I said? Can I just check?
Well, perhaps if you just go back, we've heard quite a lot, but just the last few sentences.
Okay, great, thank you. So the Innovative Environments Interim Framework has been set in the context of responding to our long-term health and care strategy, A Healthy Caring Powys, and we've got a number of key developments that we're taking forward during this year in support of that work. The proposal that we're putting forward, the next agenda item, is the broader V Community Health and Wellbeing Centre investment, which ties to this interim framework. I wasn't planning to present the detail of this report, but to open it up for questions and to reassure the board that we'll be undertaking further work to finalise the framework for approval for board later in the year.
Thank you. Does anybody have any questions for Hayley? Right, thank you. Carol first, then Mark Taylor. So Carol, if you would come in.
Yes, thanks very much. I just wanted to add that this is really quite an important paper for us to consider. We would have, under the integrated medium-term plan, brought a more substantive strategic framework for innovative environments. So just to indicate to board members that this is an interim arrangement, recognising that as hopefully we come through the pandemic, we can then give our full focus to the much longer term framework that we were seeking to originally put in place. So I just wanted to emphasise that really. So hopefully that's okay.
Yes, thank you, Carol. Mark Taylor, independent member, I can see you have a question.
Thank you, Chair. Yeah, I think it was expanded upon Carol's point. I think it's a really informative paper and takes us, I think, in terms of a holding pattern and gives a context around the capital delivery over the next couple of years. I suppose the point that I wanted to pick up on is under the next steps, is actually look at whether we can give some definitive timescale around the delivery of that strategic framework. And what I think is there at the moment is to develop, and what I would actually like to see there is a commitment to actually deliver that framework in the course of 2021.
I would be happy to come back in on that, Mark. I'd agree. It would be really good to actually get that longer term framework. So I'm really keen that we can do that. My slight pause and hesitation, I think, is at the moment we are being hopeful, let's say, about the things that we can commit to in 2021-22. But we will need to just review the position, I think, as we get to the end of this calendar year and start getting into the early part of next. We do think at this stage that the Welsh Government will expect us to do an annual report for 2021-22 rather than an IMTP itself. But we would be keen that if we possibly can get that longer term, more permanent, if you like, strategic framework in place, we would be very happy to do so. So I think it's a yes, but Mark, to be quite frank with you, just in terms of the current environment, but the motivation and ambition is there to absolutely deliver that.
I think we'd all echo that, Carol. Thank you. Hayley, would you like to add to that?
Yes, we had started the work on this, but obviously we've had to reprioritise the capacity of the team. So we are picking this up again, and we are planning to take it forward, notwithstanding the comments that Carol has just highlighted. But I'm happy to provide a more detailed update to the Performance and Resources Committee for the Chair to consider the work that we will be planning and how long that will take. But with assuming that we can take it forward, we would hope to have that in place before the end of this financial year.
Thank you, Chair.
Right, thank you. Ian Phillips, independent member, you have a question.
Thanks, Chair. It's a similar theme, really. I'm looking particularly at the table on page 9, which shows that we're in a very different place to the majority of health boards in Wales in terms of our estate and the amount of pre-1948 buildings that we have and the maintenance and all the rest of it. So there's something for me about understanding our ability to influence a focus on non-hospital type developments in order to achieve our strategy in health and providing care closer to home and supporting people outside of a hospital environment. But our starting point is, so there's two things, I guess. One is the starting point is lower than we would like it to be, but I guess the positives being where we've seen investment in things like the North Powys programme as well. So are we confident in our ability to continue to influence Welsh Government to secure that sort of funding? Because it's not, it's not a massive, big, shiny hospital, is it?
Yeah, shall I start to respond to that, Chair? Yeah, absolutely. And I think we've worked really closely and alongside Welsh Government over the last few years, and we have been supported for a number of developments that we've put in place. It's very much tied with our strategy in terms of a healthy caring Powys, that shift to working on well-being and prevention, and it's tied also to a healthier Wales, and therefore there's significant support that we've had through our capital colleagues in Welsh Government and they understand the strategic fit of what we're trying to achieve. And obviously we are looking to attract part of that available NHS Wales capital funding, including the primary care pipeline funding, which we'll be considering next for the broader V scheme. So I'm confident that we're able to present through to Welsh Government compelling cases for investment in the model of care we've developed within Powys, and there is a strategic fit. However, I think it's also important to note there's significant pressures on the All Wales capital position. Therefore, it's about looking at the balance of what they need to take decisions on across the whole of the NHS Wales position. But I think, unfortunately, despite the fact that we have a lot of old estate, actually it makes a compelling case around addressing the backlog maintenance and the risks that we're carrying in the estate as well. So I'm confident that we can put forward really persuasive cases to the Welsh Government, but obviously that will be subject to scrutiny and the overall prioritisation of NHS Wales capital across Wales.
Thank you, Hayley, very helpful.
Yeah, thank you. It was a good point, Ian, but we live through difficult times, and we're grateful for the support the Welsh Government has given us to date, certainly. Trish, you have a question.
Thank you, Chair. I have a question and a comment. My question is, I think about the risks in our capital estates, and in the annual report, under our wellbeing objectives, we talked about looking at anti-ligature work, in our mental health facilities, and I suppose I'd like an assurance that this work will be going forward in the year ahead.
Yes, thank you, Trish. We have already prioritised the anti-ligature works for approval, and that is part of the plan we've got in place, and we're in active conversations with Welsh Government to secure additional funding to undertake that work. So they have already been prioritised, the anti-ligature works, in the priorities that we set for this year.
Thank you. On a better note, though, and in respect of the Lundrindod Phase 1 work that has been completed now, given that it's my local hospital, I was really chuffed to see number of outpatient appointments up by approximately 9,500, an additional 1,160 day cases, and 924 endoscopy cases per annum, and that makes a huge difference to people living in this part of Powys. So yeah, really pleased about that having been completed. Thank you.
Yeah, thank you. I can remember when Mark Drakeford came to announce and look at the plans, and we were all wearing hard hats standing outside the hospital thinking, oh, this is wonderful. So it's great to see a good result there. Thank you, Trish. Francis Gerard, independent member, you have a question. I'm not sure if Francis can join us. Perhaps there's a bit of technical difficulty there. We can perhaps come back to that. But meanwhile, you know, I'm sure we do all support the direction of travel. So thank you very much, Hayley. So would you like to proceed and maybe deal with Francis's question outside the meeting later on?
Yes, I'm happy to do that, Chair. Would you like me to take the next item on the agenda?
Yes, yeah.
Okay. Diolch, Cadeirydd. Diolch am y cyfle I gyflwyno cais I buddsoddi yn y prosiect iechyd a lles yn ysbyty gymunedol Bro Dyfi ym Machynlleth. I'm really pleased to present the full business case for the Bro Dyfi Community Hospital Health and Wellbeing Project in Machynlleth. This is a really exciting development that supports the delivery of the model of care for Powys developed as part of our long-term 10-year strategy for healthy caring Powys. This investment will help us to reshape the way that community health and wellbeing services are being delivered for the area, and includes the integration of primary care services by relocating the Dyfi Valley Health Practice to be co-located within the hospital setting to support fully integrated social care, primary and community delivery for the residents of the area. This investment will also secure an enhanced range of outpatient and ambulatory care, and we've been working closely in partnership with Hywel Health Board that provide in-reach services within currently Machynlleth Hospital. So there's a very strong focus and emphasis on providing care closer to home. We'll also be delivering improvements in women and children's facilities and further integration and development of mental health services. And the investment very much talks in our strategy to the community hub concept, which is around improving access to health and social care, well-being and prevention, and in particularly working with the third sector and the community. The investment is a key priority that is set within the work plan of the Mid Wales Joint Committee for Health and Social Care, and we have had ongoing support from our clinical colleagues across our partner organisations in the region to develop the case. And we've also been working very closely with staff, and we're very lucky to have the ongoing support of the Machynlleth Patient Forum, who've worked alongside us to develop this proposal. This is an updated full business case which is being presented to board today, as the board are aware that we had to re-engage a new supply chain partner through the SCAPE Major Works framework, and we've been very pleased to work alongside Wilmot Dixon in preparing this case, and we've made some good improvements to the proposals contained within the case around its design, and also we've had the opportunity to take into account some of the learning from the COVID pandemic and how that needs to be applied in the context of this investment. I'm pleased to be able to report that we've now secured all the necessary planning approvals for this scheme. We've agreed the additional highways work that was required and the Section 278 agreement, and we've also negotiated a heads of term with the Housing Association about securing a very small parcel of land to be able to undertake the works to the junction. The investment will also deal with significant and high risk areas of non-compliance through our backlog maintenance in the estate, and that's to about the value of 4.269 million of backlog maintenance issues will be addressed through this investment. And we're also pleased to say that we've worked really hard to get a very good rating through something that's called the BREEAM assessment, which looks at the environmental and sustainability factors for the refurbishment and the investment in the building. The project has been identified as a priority for the primary care pipeline funding for Welsh Government, and we hope Welsh Government approval will be able to come through by early next year, January, hopefully, in line with the scrutiny process that has to be undertaken by Welsh Government. The overall programme is 77 weeks, and I'd like the board to consider approving the full business case with a revised value of 14.923 million to enable us to submit to Welsh Government. The paper also sets out the need for the Health Board to establish a project bank account for this scheme, which is mandatory and a requirement set out by Welsh Government for any scheme of this value. So thank you, Chair. I'm happy to take any questions.
Thank you. I'm sure there will be some questions. Wonderful to see what was originally built as a dreadful old workhouse being transformed into a modern unit. So I'm sure we're all very keen to see that happen. Mark Taylor, I think you were first to make a comment.
Thank you, Chair. Just wanted to compliment the team in terms of the comprehensive nature of the work, Hayley, Wayne and everyone else involved. I think the step up that the new professional team in supply chain has brought to the sort of scheme has been refreshing, given where we were having to take Chair's action a while ago with the previous supply chain causing difficulties. It's a very comprehensive piece of work. I think it brings to life what's going to be delivered, and hopefully Welsh Government will look on it very favourably, and weather permitting will be starting in January. So well done to the team.
Thank you. Melanie.
Thank you, Chair. I would echo Mark's comments and add also, obviously, this is fundamentally what Powys is about, isn't it? It's sort of almost in a nutshell. And, you know, it's been quite a long journey because of the different issues that we've had with highways and the building contractors, etc., that were beyond our control. But this is really going to sort of, you know, just running through the list with mental health, women and children, the different things that this will impact on in that area. And just as Trish said earlier about Landod improvements, this again in the Bro-Dyfi area of Powys will sort of galvanise our way forward. And I just offer my congratulations to Hayley and the team as well. It's absolutely comprehensive and it's exactly what Powys should be doing. So absolutely brilliant investment, 100% behind it, and thank you very much.
Thank you, Mel. Ian Phillips.
Thank you, Chair. Yes, the what looks to be a very much improved design. Really great to see that. Just a question of detail that I maybe within the papers, but I didn't pick up on, with the expansion in use and increased access, number of users going up. Has provision been made for the bandwidth, the technology bandwidth going into that to be increased in line with the increased use? Again, going back to what one of the previous guys said in terms of our learning from COVID and the more remote working. With this particular model, it does depend on the technology, and I just didn't see that in the paper, so my apologies if I've missed it.
Yeah, so just to reassure you, Ian, that as part of the learning from the pandemic, we've double checked the infrastructure and the requirements, the digital requirements for the scheme are sufficient to deal with a very stepped up change in use, particularly of the rollout of things like Attend Anywhere, Consultant Connect, etc., and the virtual elements of that work. So yes, that has been double checked within the business case. Perhaps not as explicit as perhaps we would want to. That might be something to reflect on, particularly because there's a number of business cases coming through over the next few weeks to the board for approval. But yes, to reassure you that that has been fully considered, the digital requirements of the scheme, on the basis that we are needing to now utilise significant levels of digital ways of working in order to manage this period. So that has been taken into account.
Fantastic. Thanks, Hayley.
Thank you. And Trish, you have a question.
Yes, thank you, Chair. Hayley, I was wondering if we're hopeful that Welsh Government will agree to funding this and indeed that we'll ratify it today. Personally, I'm very pleased to see the progress. I have been involved over a lot of years with members of the Patient Forum in Machynlleth, so it'll be good to see that going ahead. But assuming everything goes according to plan, at what point will the contractors start working?
So assuming that we have a decision, let's just say by January, part of the discussion we'll have through the capital review meetings is, depending on how long Welsh Government will take, is the mobilisation period is about 4 to 6 weeks for the contractors to actually physically start work. But we'll have an early indication from the discussion with Welsh Government about building in that, what they call mobilisation period. So if we get a decision, we can certainly be making sure that we're on site within a month of that decision starting.
That would be so exciting.
Yeah.
Thank you.
Thank you very much, Hayley. Could I then ask the board to approve the Bro-Dyfi Community Hospital Health and Wellbeing Project full business case with submission of the business case to Welsh Government? Everybody agree? Thank you. And also approve the implementation of project bank accounts for this full business case and all future projects in excess of £2 million as mandated by the Welsh Government. Everyone approve? Thank you. Thank you very much. Now we need to return to something which is not unfamiliar, mechanical ventilation and ratification of Chair's action, after which we can have a short break. So, Hayley,
Thank you. Diolch Cadeirydd. Hoffem i'r bwrdd gadarnhau'r penderfyniad Cadeirydd i gymeradwyo 930,000 o bunnau i osod systemau awyru mecanyddol. Thank you, Chair. We would like the board to ratify the decision to approve 930,000 funding to install mechanical ventilation systems. We are responding to guidance in relation to COVID-19 infection prevention and control measures, and it should be noted that ventilation is part of a range of measures we have available to mitigate risk. The work is planned in 2 phases, and the first phase is to implement enhanced ventilation into 3 hospital sites across Powys, those being Welshpool, Llandrindod and Brecon, which aligns with the decision that was taken earlier in the year to strengthen the VIE bulk oxygen delivery to the ward areas in the same 3 hospital sites. And this is in line with the clinical response model we developed during the first phase of responding to the pandemic. Phase 2 of the programme would entail engaging suitable contractors to introduce aerosol generated procedures, appropriate ventilation into a small number of rooms for each of the other hospital sites, and additionally to some of the dental suites across Powys. I'd like the board to be reassured that we've been in ongoing discussions with Welsh Government regarding the approach and that we've taken to managing the ventilation strategy, and Welsh Government is supportive of the approach that we've put forward and has confirmed through the capital review meetings that we have that the funding for the ventilation works has been included in the Welsh Government capital plan as COVID related capital costs. So I'm happy to take any questions, Chair.
Thank you. Mark Taylor.
Thank you, Chair. I just wanted to clarify the paper says the purpose is to ratify the decision taken in Chair's action, which basically approved the 630,000, I believe. So I think there's a perhaps inconsistency between the purpose and the recommendation.
Sorry, so just to clarify, in the meeting it was approving the first phase of works, which is the 630,000 mark. So you're absolutely correct. Apologies that there's an inconsistency there. So that's what we actually approved in the Chair's action meeting, but the approach will come back then for the second phase of work for a decision. Yeah.
So what are we being asked to approve today, the 630 or the 900?
To ratify the decision taking in Chair's action to do phase 1 of the works, which is the £630,000.
Thank you.
Thank you. Yes, you're quite right. Thank you for pointing that out, Mark. I can see 970 at the bottom of the page there, which is not what we're being asked to approve. So are you all happy to, or perhaps Rani, you have something that might clarify this?
Thanks, Chair. No, just to confirm, as Hayley has said, it was the phase 1. So the Chair's action had considered both phases, but approval was given at phase 1. So the board is asked to ratify that today.
Thank you. Everybody happy to ratify that? Thank you very much. And now we can have a short break. Could you come back, please, at 11:15? Well, let's hope we can all get back by we'll aim for 15:15, if not 20 past at the very latest. Thank you very much.
apologies for my early.
Francis? Can you hear me now?
Yeah.
I'm so Welcome back, everybody. Sorry for the slight delay. We've had a couple of technical difficulties. I'd like to introduce Hayley for the next agenda item. She's going to give us a presentation on our winter plan. Go ahead, Hayley, please.
Thank you, Chair. Diolch Cadeirydd am y cyfle I gyflwyno y gofynion a nodir yn y cynllun amddiffyn gaeaf I fyrddau iechyd. I ni'n gorfod cyflwyno ein cynllun I Llywodraeth Cymru erbyn y 4 ar 15 o Hydref. Thank you, Chair, for the opportunity to present this. This presentation will take us through the winter protection planning requirements set out by Welsh Government for all health boards in Wales and our need to submit our Q3 and 4 plan to Welsh Government by the 19th of October. I understand Caroline might be putting some slides up. I can't see them, so I'm assuming they'll be coming up as I'm speaking. Okay, so the plan for Q3 and 4 is a continuation and builds upon the Health Board's Phase 2 approach, which we signed off initially in the board in May of this year, and then the second iteration for Q2 in July. The Q3, Q4 plan is significantly focused on winter protection and resilience arrangements, and this also aligns with our need to work with the Regional Partnership Board in Powys to submit winter protection plans at the end of October that covers the broader partnership agenda. We've got really strong joint planning arrangements and joint working across our key partners within Powys, including regional resilience forums where we work with Dyfed Powys, Shropshire and Telford and Wrekin, and Herefordshire and Worcestershire as well. And it also includes the Q3, Q4 plan, the work on the third sector, who are often the first line of support for our communities and individuals at this challenging time, particularly for those people who have felt isolated or who are shielding. The plan has to reflect our role as both a provider and as a commissioner. And we have to also set out our approach to both managing the COVID-19 and the delivery of essential and non-essential routine care. And it's important to note that obviously we're working at the moment in quarterly operational planning cycles, but we've always got an eye towards the longer term strategy and what we were trying to achieve that was set out within our 3-year plan and our annual plan that we described earlier. So in terms of the update within the winter protection plan, the government published this in September, and it sets out a cautious and flexible approach to how we should be responding to the challenges that the pandemic propose for us to respond to. And there are a number of key delivery requirements set out within the winter protection plan. Just to highlight a couple of these, obviously the prevention and response planning requirements were developed through Q2 and need to be strengthened going into the winter period, with a particular focus now on mass vaccination and also further work on local outbreak management and how we do that work. The care home sector is an important sector. We've worked alongside with social care as well, and our plans will need to respond around our readiness for winter as a system overall. And finally, there are a couple of elements just to mention. It covers all the key areas of our work, but in particular, workforce is a really important factor around how we're going to be able to manage our response during winter. The role of technology and digital is highlighted, and huge progress has been made around digital ways of working, and also the planning requirements set out the requirements around the financial allocation. Okay, so just to remind the board, the integrated medium-term plan was suspended by Welsh Government this year and has obviously been replaced by these operational planning requirements. So in addition to the winter protection plan, presented by Welsh Government and published by them. We've also had a specific sort of letter received as an accountable officer letter by Welsh Government on the 24th of September, which again sets out our requirements and the approach to the financial allocations. And within these appendices, we've also got to cover off quite a lot of detail around technical and assurance requirements, and those templates are now mandatory for health boards across the whole of Wales, because rightly so, the government are trying to develop a national picture, comparative picture, to be able to look and develop the right policy response. Our Welsh Government planning framework is still based on the four areas of harms, which the board will be familiar with, and broadly is in line with the WHO dual track approach, which is around making sure, first of all, that we're COVID ready, and then the second track being very focused on our recovery planning. We've also had to ensure that the learning that we've taken place during Q1 and Q2 and lessons learned are actually incorporated within this plan. The accountable officer letter requirement, just to sort of highlight a couple of things really around this, is that we will be setting the financial allocation discussion. We've already had an initial assessment of this, but further discussions will be informed by the submission that we submit on the 19th of October to Welsh Government. And again, just to reiterate to the board that the Welsh Government have set an overview to the approach, which is cautious and flexible, and caution is still being advised. Plans are to be framed by reset, recovery and contingency planning, and there is reference to both winter and also the EU transition in the planning guidance. The Q3, Q4 requirements, there are a number of key areas and cross-cutting areas. Again, board members, to be reassured, we'll share this presentation and a bit more detail around it, so that this presentation will help you to be able to assess the plan that you receive in the October board meeting against the planning requirements, and we'll clearly set out to what and how we will be meeting the planning requirements within our plan. So we will have to consider specifically around prevention and response, the separate COVID prevention and response plan, and particularly highlight any risks, workforce or financial consequences associated with the prevention and response work. There's a very strong focus on essential services, and primary and community care is absolutely key to our clinical response model within Powys. And we'll also have to set against the urgent and emergency care requirements our progress against the 6 goals, and again a strong focus on flu and the mass vaccination approach that we're putting forward as well. Specifically in terms of organisational capacity, just wanted the board to be aware that surge capacity, bed capacity, there was an earlier announcement by the Minister earlier this week around the surge capacity, and we've been working with our providers across the region of Wales and England to make sure that there is the Powys population flows to those providers are included in their modelling for both critical care and acute care bed capacity. But as a provider, we've also been ensuring that we're flexing up as much as we can our offer within our community hospital space, so that we can facilitate the flow to and from community and back from the DGH hospitals as quickly as possible for the Powys population. And then just again to reiterate the workforce elements, it's very important that we have a clear workforce plan going into winter, recognising that we will have to deal with a number of factors, including potentially higher sickness rates as well during this period. And there will be a discussion at a regional and national level once all our plans are submitted around areas particularly where we found in phase 1 we offered some mutual support to some of our neighbouring providers, because there will be potentially surges happening at different times in different parts of the system across Wales. Just in terms of additional requirements then, routine services, there will be an expectation that we do a readiness assessment about routine services, and this will have to be based on the assessment of capacity, but also ensuring that we're abiding by the essential services and Royal College and clinical guidance and checklists. I've already mentioned to you before around lessons learned gathered during phase 1 and 2 needing to be included and referenced within our Q3 plan, and also just to reference the EU transition has also been referenced in the planning guidance, and we'll have to deal with that as well in terms of our approach. And the final one, and not an insignificant one, it's around stakeholder management, communication and engagement. This can't be underestimated, because our ability to respond to the pandemic is based on our communities and the public working alongside us to try and keep the infection rates low within the county, and there'll be a very strong focus around communication and engagement. There are a couple of additional slides here which are sort of setting out particularly around essential services, some of the technical and clinical guidance that we've had received over the last few months, and again just a reminder that we are all working to the guidance on essential services, and also the ethical values and principles framework is addressed, and that we will need to make sure that we're sort of taking into account and moving forward into the winter period to address those requirements within essential services. And then there's also additional content around assurance and governance, and I know as committees and the board you will want to be assured around the governance relating to both our plan and our delivery of our plan, and in particular there's specific requirements that have been set for essential services, and ensuring that the access and data that we have available on essential services is included, and that is a requirement both as a provider but also as a commissioner of services. A couple of slides just to mention, we have a minimum data set. This is mandatory, so every health board in Wales will have to complete it, and it broadly covers the areas I've just described to a level of detail where Welsh Government want to see, be able to see differences between the regions and being able to understand the total picture across Wales. Clearly for us, we've got a large population that go into the English system, so we have a level of complexity for our resident population that we will have to manage in the narrative plan that we submit to Welsh Government around the detail. And then just finally, a couple of things just to say that the plan production is has already started prior to the guidance being published. We're now at the space where we're looking at where there may be additional content required, and we're very focused over the next sort of 2 weeks to make sure that we have the right processes in place to complete the necessary mandatory templates set out by Welsh Government. The draft plan will be shared for Strategy and Planning Committee for discussion next week. It is a very early draft. We're still working to this very carefully, and we will be bringing it back to the board on the 20th of October for final approval, but we'll need to submit the day before as a draft for the Welsh Government to meet the deadlines. We've got a very strong working draft and a framework to work to, and that's set out within this plan, planning framework. Just to remind you again, in summary, we're working to the 4 areas of harm. We're very clear about the really important role the prevention and response model has in helping us to manage this situation, so there will be a strong focus on the content, both in terms of prevention, mitigation and control, but also the management of clusters, incidents and outbreaks. Our sampling and testing plan our contact tracing, and then how we're working with high-risk settings across sort of Powys, including the mass vaccination planning work. And then our operational services is broadly a very important element here is self-care, family and community sector, and what we can do to support this work. Our primary care is very important in community services, and then obviously in terms of our onward pathways for our population, we've got a strong work stream around regional, district general hospital and specialised services. And all of this is underpinned by our workforce, our ability to get the right procurement of estate, facilities, PPE, logistics. All of that is a very, very important part of how we respond going into winter. And the support services model has been core to our ability to respond over the last period. And then just finally, you know, the workforce plan, there's a very strong focus on what we need, the plan for winter, but also on the health, safety and well-being and the pastoral care element for our staff to make sure that they can remain in work. I wouldn't be a planner if I didn't remind us that we're in the very short-term space for operational planning at the moment, thinking about now until the end of March. And the final slide is just to remind us that we will need to sort of rethink our annual plan and our sort of longer term IMTP. I think we will be expecting the requirement for an annual plan to be submitted to Welsh Government at some point before the end of the financial year in order to meet the requirements of the Act. So again, we will need to make sure that we are able to do that piece of work probably in the next couple of months, so we can submit our annual plan for next financial year. So I'm sorry that was quite a lot of information, Chair. I hope you can appreciate we only had the guidance last week, so we're trying to summarise it. There's a lot in there for the board to consider, but I hope it gives a sufficient overview to enable you to, when you receive the plan for final approval on the 20th of October and for the purposes of the discussion in the Strategy and Planning Committee next week, that it helps you to see the framework of the expectations that we're needing to be putting in place as a health board. And I'm happy to take any questions.
Thank you, Hayley. That was an excellent overview. And really quite a complex issue. I can see how much work has already been done there and how much detailed work there is to cover in the future. I don't know if Carol would like to add something as Chief Executive.
Yes, thanks very much. Just a couple of comments to add to Hayley's, really, and it's just to stress a couple of things. So the winter protection plan that was published by the Health and Social Services Minister 2 weeks ago now, I think we see that as an umbrella plan for there being a number of plans that sit underneath that. We've had discussion, we've had an executive to executive session with our colleagues in Powys County Council, I think that was last week, and we've had a discussion at the Regional Partnership Board, and we all agree that it is essential to have these plans aligned as a totality of response to the winter protection plan. So I think that is an important step forward and commitment there. I think Hayley's absolutely right to finish on her presentation with an eye into the longer term. It is likely to be an annual plan into 2021-22, and we will need to consider what the longer term impacts of the pandemic have been. There's some very, very interesting evidence and information coming out of Public Health Wales, for example, in terms of the impacts on children, young people in particular, and on people and their own sort of mental health and well-being. So we will need to be really clear as we move forward into next year's plan and beyond what our wider response is to those issues that could have a number of years' impact yet. And just to say that in that there was an emphasis on essential services as well through Hayley's presentation. We will be trying to do as much as we can possibly do on ensuring that those essential and routine services can be provided as much as possible, because we recognise the impacts of people not being able to access those services. So there will be quite a, I think, medium-term recovery challenge in terms of the activity that we have not been able to progress. And then just finally, I think the sign-off mechanism is key. Hayley mentioned this to be an accountable officer letter. So as the accountable officer for the organisation, I think it's going to be very important that we get good board engagement and oversight, and I know that there's a more detailed discussion plan for the strategy and planning committee next week, so I look forward to participating in that. But thanks Chair, thanks Hayley for the presentation.
Thank you, Carol. I can see that Ian Phillips would like to ask a question.
Thank you, Chair, and thank you, Hayley, for the really helpful overview, and look forward to receiving the more detailed plan, but a very comprehensive overview in terms of all the areas that need to be covered within that plan. So no mean task for you guys again. I just wanted to ask a specific, really, in terms of test, trace and protect. And in this section, you talk about one of the Q2 achievements was the transition between the military and contractors for mass testing units. So two things, really. I think is a word of thanks to our colleagues in the military for undertaking all of their work. I think it would be appropriate for us to recognise them at this board for doing that. And the second bit, really, I guess, for the people that we serve, is there's been quite a lot of serious issues reported with the efficacy of the independent contractors for mass testing. I just wondered what's our experience now in Powys following the transition.
Hayley?
Yeah,
Sorry.
apologies. Sorry. Yes, obviously we have had issues with the mass testing position, and we've been working alongside our partners in Public Health Wales to ensure that they're fully aware of those issues. I'm wondering, Carol, whether you would like to sort of comment further on the actions that we've taken through the Strategic Oversight Group to address that issue. Is that okay?
Yeah, thanks very much. Thanks for the question, Ian. I think it's really key. I mentioned this in my overview report at the beginning of the meeting. So I think the core of the issues have been reasonably well aired in the media, to be quite frank. And clearly the Lighthouse Lab, which is the UK provision of laboratories, and that the extension of that is the private contractors that we have working in Powys. The capacity of the Lighthouse Labs, the demands on that have been extremely challenged. We still want to use the Lighthouse Labs because we are being reassured that those issues are being dealt with, but we are also using Welsh lab capacity as well, so we've got those two routes, and we are exploring now very rapidly the potential of having sort of local laboratory capability, not to the same extent clearly as some of the big laboratories, but there is more capability on point of care testing, for example. So we are actively looking at that, because that again will provide another string to our bow, as they say, in terms of testing, because we can only anticipate that we will need to continue to test very large volumes of people through the winter period. So the testing issue has been challenging, but we have been able to largely respond to the requests, although some of the experience of people in our communities has not been where we would have wanted it to be.
Thank you, Carol.
Susan, do you have a question?
Yes, thank you, Chair. I'd like to ask, please, are there plans for the Army to be involved in Powys Teaching Health Board mass vaccination programme?
I'm very happy to come back in on this. Thanks very much. The real emphasis at this stage, Susan, is on having a range of options developed for mass vaccination. We still have the military working with us, and as Ian said earlier, they've been hugely helpful. They're experts in logistics and in planning and in emergency situations, and all of that has been extremely helpful. In terms of the mass vaccination, we are discussing both with primary care, we are discussing an option of our own direct delivery, but we recognise that we may well be needing to partner with the military or with others to enable such a large vaccination programme to happen and to happen smoothly. So those options are very much on the table and being discussed at the moment, Susan, and I'm hoping that when we come back with the plan, which is the response to what Hayley's presented, those options will be laid out and firmed up a little bit more.
Thank you.
Thank you. Are there any questions? Obviously, this is something we will be coming back to in much greater detail at a later point. Trish Buchan.
Hi, Chair. Thank you. I noticed one of the requirements set out in the slides was zero tolerance to delayed discharges. Can I ask, to what extent is that reasonable, and what have the last 6 months told us about that?
Yeah, I'm happy to come in there. Sorry, apologies. Yeah, Trish, I think that it's a really important point, and part of what we've been doing is working very closely with our social care colleagues to facilitate flow and to reduce the number of delayed chances of care. During this last period, we haven't been formally reporting delayed chances of care, but obviously we've been tracking that through our flow coordination hub on a daily basis, and there is still system, and we still need to continue to work on making sure that that is the case. But clearly, I'm wondering whether Jamie would like to come in and provide some additional assurance around the actions that are being taken to address the delayed chances of care. I think it sets a vision around zero tolerance, but we recognise that a number of areas across Wales are working collaboratively with our social care partners to address and improve the performance as best we can going into the winter period. Jamie, would you like to come in and comment further?
Yeah, thank you, Hayley, and thank you for that question. I think Hayley's covered the fair point. We have nationally altered the reporting mechanisms on delayed transfers of care. Members would be expecting me to have been very close to this process throughout the past 6 months, particularly, and a focus on what we call flow would be one of my key focuses on a daily basis. I am pleased to be able to report that in the main our flow in support of patients who need to come back into our beds has been very expedient on a very regular daily basis with all of our surrounding DGHs, and we would want that to continue throughout in the spirit of this no delays in any system. Patients can be delayed for many reasons, of course. They can be delayed for health reasons, they can be delayed for social care reasons. But also one of the key things we've been focused on is making sure the patient is going into the right place for them. What's been very pleasing for us has been a focus on what we call discharge, recover and assess models across Powys, and that actually a hospital bed in Powys is not always the right location for a patient anyhow. This will be a challenge for all health and social care sectors across Wales during the winter period. I think Hayley made a comment. The statement of a zero tolerance for detox is the right intent, but there will be an ambition to make sure we can honour that. But it'll be daily challenges on that at times, depending on the needs of a particular patient and what their requirement might be.
Thank you. Katie, do you have a question? Katie Blackburn. Do you have your mic on mute, Katie?
Yeah, sorry. Yes, please. Thank you, Viv. I'm just looking at the last slide, Hayley, that you've put up, and just making an observation, really, that transforming in partnership and the primary care axis doesn't have a dot in it. I'm just wondering whether there's a reason for that. Well, I would have thought that primary care and transforming in partnership are aligned.
Absolutely. I think that's an error, an administrative
That's
error. So apologies, Katie. Yes,
that's fine.
Illustrative. Yeah.
Well spotted, Katie. It's good to know somebody's on the ball. So difficult with so much information, but thank you. Are there any other questions about this before we move on? No? Well, thank you. We were just asked, I think, to note that, because it is something that we'll be returning to in the near future. So now we move on to the report of the South Powys Pathways programme, and that's you again, Hayley, I think.
Yes, diolch Cadeirydd. Mae'r papur hwn yn diweddaru'r bwrdd ar gamau ar gymeryd gan y Bwrdd Iechyd i ymateb i benderfyniad Bwrdd Iechyd Prifysgol Aneurin Bevan i olwyso'r gwaith o agor ysbyty'r Grange o fis Fawrth y flwyddyn nesaf i fis Tachwedd eleni ymhen 47 diwrnod. Thank you, Chair. This paper updates the board on actions being undertaken by the Health Board to respond to Aneurin Bevan University Health Board's decision to expedite the opening of the Grange Hospital from March of next year to November of this year, which is in 47 days' time. This winter is expected to be difficult due to the need to deal with the COVID pandemic demand alongside the normal winter pressures we face. And the decision to open the Grange early is an important part of Aneurin Bevan's Health Board's winter protection planning and will support them to manage demand and to enhance critical care and surge bed capacity. This paper contains within it, from pages 5 to 6, details regarding the services that will be provided in the Grange Hospital and the impact on Neville Hall Hospital. As a health board, as Powys, we're implementing the recommendation contained within the South Wales programme, and so on page 9, the assumptions we are working to are set out, which is the basis of which Neville Hall was identified as a strategically important hospital in the context of the South Wales programme, because it is the closest district general hospital with an emergency department for the majority of the South Powys population, and we will be expecting our flows to shift to Prince Charles Hospital. We are responding together as a system to the compressed timescale of the opening at pace of the Grange, and we have developed a risk-based plan that focuses on the first phase emergency and urgent care pathways. There's been significant activity undertaken, and I'd like to thank members of the programme board and the team who've worked tirelessly to understand the impact of the earlier opening on activity flows, and there's some detail contained within the report on this. And we're strongly working in partnership with Cymtaf Morgannwg, with Aneurin Bevan, and also very importantly with WAST, to understand the whole system and how we should and need to respond together. We've also initiated bilateral conversations with Cymtaf to ensure that the transition of pathways is smooth and that we do all that we can to facilitate flow to and from Powys, including ensuring our services that we can provide within Powys are fully utilised. And one of the examples of that is about making sure that the Brecon Minor Injuries Unit is its role and its importance is understood and used by the local population. All of this work has been coordinated and overseen by the South Powys Programme Board, and that is chaired by Carol, our Chief Exec. Over the last month, we've held a number of 2 programme boards with another meeting planned for Friday. We've had a clinical summit, facilitated medical director to medical director discussions, and we've held a number of task and finish meetings to ensure that there's a shared understanding of how we will work together. And importantly, we've agreed that we will need to complete a system readiness assessment as part of this process, because I'd like to reassure the board, particularly in light of previous discussions that we've had, that patient safety and quality of patient care will be at the heart of our consideration in managing the changes in November. Last but not least, there's been significant progress undertaken on communication planning and how we will ensure the public understand the changes to these services. And I particularly like to thank the Community Health Council for their input in helping us to develop this plan, and also offering us some local insights to inform our approach to, for example, the household drop that we're planning to do to all of the households affected by this change. We've also in the process of finalising the detailed timetable of these activities, and that information we will be able to share at the next board meeting in October. But we've made significant progress on the communication planning. Finally, from my perspective, this is a key strategic priority that was set out in our last board that we will be working on as a board, and I know that we will need to work very closely with our partners to ensure that we put in place all the necessary arrangements, because we do need to facilitate and help support Aneurin and Bevan to achieve the earlier opening date of the Grange safely, so that we're best placed as a system to manage what is likely to be a very challenging winter period for us all. So, Chair, I'm very happy to take any questions the board members may have.
Thank you, Hayley. Are there any questions? No, I can't see that anyone is asking any. So can we please just note that, and note also that there'll be further opportunity to discuss South Powys at Strategy and Planning Committee next week. Thank you.
Chair, so apologies, Chair. It's Carol here. I just wondered if I could add a few comments. My apologies. My signal wasn't working very well. Yeah, could I just say that this is a very tough ask, I think, for the system in terms of the speed with which we have all had to work, and I would just want to reiterate how important it's been to stress that all 4 health boards are working really closely together. We can see already the second surge is here, you know, and the projections of hospitalisations, etc., have been shared very widely in the media, and so therefore we have to do all that we can to ensure that we're as well prepared as possible. I did just want to draw attention, because ordinarily winter is a very difficult period anyway, and a lot of access difficulties in district general hospitals, but just to flag the expansion of capacity across Wales. Hayley mentioned it under the previous item as surge capacity, but if I can just say that the Welsh Government are estimating approximately 5,000 additional beds across Wales to help with the winter challenges that we will, I have no doubt, be facing. So we will be arranging our focus on our core actions on that risk-based plan in the wider context of winter protection planning and the mechanisms that we're also putting in place more broadly as well. So I think we're going to come back to this really key discussion again in strategy and planning, as you say, Chair, but also in a subsequent board meeting. We do want to be as assured as we can possibly be that we've done everything we can to prepare for the winter period, and I recognise that at least part of that is our very close working with the Community Health Council, and I would want to reiterate Hayley's comments of appreciation of the input from the CHC.
Yes, and I think perhaps Katie, would you be able to add something to help us there?
Yes, thank you, Chair. I think as Melanie mentioned in her report, there was quite a challenging meeting that took place on the 12th of August between the Radnorshire and Brecknock Committee and the Health Board, but equally it provided an opportunity for members to air their concerns, which really fell into sort of three categories. Firstly, the sort of clarity on the pathways, secondly, the communication, but also the pressure on the timescale, recognising the challenges of opening an early opening at the Grange and recognising the importance of that, I must add as well. But following that meeting, we've had a lot of very, very positive discussions, and as Carol and Hayley have both mentioned, working together, we're meeting with Carol and Hayley on a weekly basis. There's a commitment to a lessons learned review at a later date, because our focus at the moment is obviously for the opening in November. And I would also really like to thank Adrian Osborne and Hayley for using the CHC as a check and challenge. So we have fortnightly check and challenge meetings now. I think, as Hayley mentioned, to try and unpick some of the sort of really local issues. So having had a little bit of a tough meeting on the 12th, I think things have really, really moved on, and there's a huge amount of work going on. So I'd like, equally to thank the team for involving us and providing us with that assurance.
Oh, thank you very much, Katie. I know that CHC is working closely with us, and we're really grateful for that. Trish, I think you want to come in. Are you on mute, Trish?
Yeah, no, it's fiddly. I actually think much of what I was going to say has actually been covered by Carol and Katie together. As chair of strategy and planning, though, it is clear that we will be picking it up, but we're working on two different areas, each of which are important. The speed of getting up our COVID surge and the opportunities that are provided by the Grange, but equally the challenge to our own population and making sure that we balance that and any risks there, and that we mitigate them where we can. But it's no easy task, particularly in the short time scale, and just acknowledging the help that the CHC are giving us. Really grateful for that.
Yes, thank you for that comment. I mean, times are unprecedented. They really are. Since the start of the NHS, nothing like this has happened. So we try our best to carry on as normal, but it's not easy. So, I mean, really that we've had some discussion and we've noted that, and we look forward to further developments as we know them. So we will, of course, share them with our population. So thank you. That means perhaps we should be moving on then to the next item, which I think in Stuart's absence, Carol Shersby will be presenting, the European Union Transition Planning.
Thank you very much, Chair. The paper has been previously circulated and is available to board members. We were extremely occupied by Brexit, exiting the EU earlier in the year, and of course through 2019 in particular. And perhaps this has stood back a little bit in the minds of the public over the last 6 or 7 months or so. It has been very much still on our radar, and in particular now as we move towards the end of this calendar year and the 31st of December, the intensity of our planning arrangements has increased in line with the expectations from Welsh Government and the coordination of Welsh Government with all of the health organisations in Wales. So the paper really outlines the key areas of particular focus, and you can see that much of that is on supply and supply chains. Well, the global pandemic has certainly tested our supply chains on a number of fronts, and so there's been a lot of work to strengthen those in relation to the pandemic, which of course will then also strengthen in terms of the EU transition. So I wasn't planning to say very much more than that, Chair, really, but I'm content to take any questions. And if there are any questions that are a little bit more technical, clearly Stuart Bourne, the Public Health Director, has been leading on this, and we can get back to members should we need to. Thanks, Chair.
Thank you, Carol. Had it not been for the pandemic, no doubt we would be seriously focused on this, but it's so difficult to deal with it. And, you know, our role as a health board during a pandemic. Are there any questions, please? Well, thank you. We'll take that as information and move on to the next agenda item. That's 3.4. The Nurse Staffing Levels Wales Act, piece of legislation actually introduced by Kirsty Williams, our own Kirsty Williams. So we should be very proud of this. Alison Davis, I think as Director of Nursing and Midwifery, will be speaking to this paper.
Diolch, Chair. Thank you very much indeed. I'm pleased to bring you the annual report for the Nurse Staffing Levels Wales Act 2016 as it applies to Powys Teaching Health Board. Members will note in the purpose of this paper there are 4 distinct elements, and this paper is slightly different for our health board than others in Wales. As members will recall, the detail of the Nurse Staffing Levels Act relates to specific requirements around acute medical and surgical wards and the need to be able to demonstrate sufficient nurses to care for patients sensitively, and it's the latter element given our services that we focus on with our provider element. However, as I said, there are 4 elements to this. So one is the Health Board's compliance with the Nurse Staffing Levels Act as it applies to the services we provide. The other is in relation to services we commission from health boards in Wales, and a further element is the services that we commission from our colleagues in NHS England trusts across the border. There's a 4th element to this paper which provides some information on the proposed extension of the Nurse Staffing Levels Act into various nursing disciplines, which is there for information. So board are asked to discuss the contents of this paper, please. As board will know, the law was passed in March 2016, and there are a range of reporting requirements associated with this legislation. In March, as a result of the pandemic, Chief Nursing Officer for Wales wrote to all health boards advising support for the potential deferment of the annual report, which was generally provided in May. Hence, the report's been tabled this month in line with Chief Nursing Officer requirements. So there is some detail in the paper, and you note that from the written evidence available, it seems that we, as Powys Teaching Health Board, can take assurance the health boards in Wales are compliant with the systems required to monitor and report against the Act. Welsh Government have quite a substantial scrutiny and oversight of compliance with the Act, and reports are in the public domain. My opinion is that there's evidence there that the health boards are striving to comply with the Act. In relation to our NHS trusts in England that we commission, obviously the Welsh legislation does not apply in England, but there is a policy context to staffing, and the nurse staffing is subject to scrutiny by the Care Quality Commission, the CQC, and we've heard mention of CQC in relation to some of our agenda earlier this morning. As an organisation, we have a clinical quality review process and the quality assurance frameworks that help inform our position in terms of staffing in our assessment of assurance for our English colleagues. Working with the Care Quality Commission's regulatory reports and some of the board and other publications made by our NHS England colleagues, I think Powys Teaching Health Board can appreciate that our colleagues in English NHS trusts appear to be striving to comply with the policy context in England as well. There's been mention of Shrewsbury and Telford NHS Trust earlier this meeting, and just to draw members' attention in the paper to their position on nurse staffing and the subsequent actions taken to address that. Last but not least, from our own provider perspective, we've got a number of arrangements in place to help us comply with the Staffing Levels Act, and you'll see those listed in the paper. And also identified here that going forward we'll pull together a local group of key stakeholders and individuals so that we can take greater oversight, coordination of this whole agenda and help us move forward in terms of extension as well. That's it in a nutshell, Chair. Happy to take comments or queries.
Thank you, that's very useful and informative. Does anybody have a question? Mark Taylor, I think, is next, yes.
Thank you, Chair. It's a relatively new area for me, so please excuse any ignorance that I may betray. What for me perhaps would have brought the report to life a little bit was in terms of our own provision, is some more objective data. And whilst this may have gone forward to other committees and other fora, I think for me it would have been useful to have some of that incorporated so I could actually look at triangulating that in my own mind. Just a comment.
Thank you, Mark. That comment's very welcome, and I'm sure we can build that into this reporting going forward.
Thank you. Susan Newport, independent member, would you like to put your question?
Yes, thank you, Chair. I really just would like to ask, please, are there always, do we aim to always have 2 registered nurses on duty to ensure that best practice in checking, particularly around issues as CDs, IV medication, etc.? I appreciate that emergencies will always occur and staff are off sick, but is that our aim, that there's now always 2 registered nurses?
Thank you very much for your question, Susan, and it's an interesting question. I think we would, as per the Nurse Staffing Levels Act, use professional judgment and triangulation of evidence to identify the levels of registrants and healthcare support workers needed in any clinical setting. By and large, that does equate to 2 registrants at the moment, and part of our strategic direction of travel going forward is to look at new and different models to provide safe and effective nursing care in all our settings. I'm sure you'll be aware of the significant challenge in terms of registrant availability in Powys, Wales and across the UK, and indeed compounded by the multiple requirements for registrants in relation to mass vaccination and managing the wider elements of where we find ourselves. So in answer to your question, professional judgment is the key component and informant of the nurse staffing levels required in our clinical settings.
Thank you. I appreciate there are many challenges.
Thank you, Susan. And Trish, you have a question again, I think.
Yes, thank you. We have closely monitored the implementation of this Act through the quality and safety over the years since its inception, but I found this paper really helpful in terms of disentangling what our responsibilities are as a commissioner and for our own services, and I was really pleased to see that we'd be looking at midwifery, mental health and our district nursing and our health visiting going forward. And I just wondered what would be the mechanism by which the board would keep sighted on this work as in the future?
Yes, thank you very much indeed for that point. Yes, the small but succinct overarching group that we brought together locally will report in through Quality Governance Committee and up into Experience Quality and Safety Committee, so that there's full opportunity for scrutiny and oversight.
Thank you. I look forward to it.
Thank you.
Thank you. Thank you very much, Alison. We note that, and it is helpful, as Trish said, in helping us to be absolutely clear about our responsibilities to all our patients. So thank you. Right, agenda item 3.5 now. This is Hayley again. Hayley has a very high input into this agenda, But that is not to say that other people are not working very hard as well in the exec team. It just so happens that this agenda involves a large amount of work that's being done by Hayley and her team. So over to you then.
Thank you. Diolch, Cadeirydd. Thank you for that introduction. I think when it comes to the questions, Chair, these reports are organisational wide, so I'll be looking to my colleagues if there are questions. But happy to present them. Diolch. Mae'r adroddiad hwn yn crynhoi ein cynnydd yn erbyn cyflawni ein cynllun yn ystod wythnos diwethaf hyd at diwedd y mis hwn, mis Medi. So this report summarises the progress made against delivery of our plan during the last 12 weeks, and that covers the period up until the end of September, which is today. Our Q2 plan was approved by the board in July, and it set out the range of actions against the 4 areas of harm that we were progressing during this period. This report is a high-level narrative summary of progress against some of those priorities. The next item covers a separate performance report, which is more around the overview against some of the key measures and the data. The report sets out the significant work being undertaken by the Health Board and our Q3/4 plan, which we've just discussed earlier, will build on the progress we've made during this quarter. I'm not going to attempt to summarise the report, but I'd just like to bring to your attention that we did, during this period, change the language from test, trace and protect towards the prevention and response plan, and there's been significant work that's been undertaken during this period around the mass vaccination planning and taking this work forward to the next level for the winter period. I'd like to particularly thank this work and progress against our plan has resulted from partnership working across primary care, social care, local authority, third sector, the community, the care home, independent sector and all of our neighbouring health providers, and we've had assistance and supported each other to ensure that we've been able to deliver against these priorities over the last quarter. I'd also like to thank the collective efforts of the staff and the volunteers and community members for their contribution in responding to this plan and the pandemic. There's quite a lot of detail in the report, Chair, and I'm very happy to take any questions you may have.
Thank you. Are there any questions? It's very much for information. So if there are no questions, perhaps we can proceed with the next agenda item. Thank you very much. So it's performance overview.
Diolch Cadeirydd. Mae'r adroddiad hwn yn darparu'r trosolwg perfformiad ym mis 5. So this report provides an overview up to the month 5 available information in August. This report, the first part of the report sets out some of the COVID related information at a summary level and covers information around testing and the number of positive cases. Sadly, Board, since the start of the pandemic, 100 Powys people have passed away due to the pandemic, and we've included information in the report about this. We also track the 7-day incidence rate, which is included in the report, and I'd like to say that we are doing really well in Powys, but this figure is increasing, with today a rate of 19.6 per 100,000 population. So it's really important that we continue to work hard together to reinforce all of the measures we can put in place as individuals and organisations to reduce the spread of the virus in the community. 2,000 tests were performed on Powys residents during the week ending the 18th of September. We continue to track our performance around testing on a weekly and daily basis. We've got very good performance within the contact tracing services, working strongly with the local authority here. And Carol Shilleby, our Chief Exec, mentioned earlier that we're reviewing the capacity of our prevention and response plan and teams, particularly around tracing, to ensure that our performance is maintained as the number of positive cases to be traced increase. This report also sets out our progress against the key NHS delivery framework. I just wanted to highlight a couple of areas. Clearly, we've already covered earlier in the agenda the work and significant focus that we need to have on ensuring flu vaccination for the winter period. I'd like to highlight to the board that the backlog of people waiting for treatment across all specialties, therapy, diagnostics is significant, as both a provider of services and as a commissioner. And this is despite the significant work that's being undertaken operationally to maximise the number of patients we can see. There has been a substantial impact on our ability to get the same levels of throughput of patients, because we've needed to ensure that the systems of working are safe. PPE, social distancing measures, etc. have had an impact. I'm afraid to say, Chair, there is an error on page 12 of the report regarding the referral to treatment times for commissioned services which are sourced from NWIS. This is with regard to Robert Jones and Agnes Hunt. An issue has arisen regarding the accuracy of the information. You'll see for the over 52-week waits, there is a 0 placed against Robert Jones Agnes Hunt. This is inaccurate. There has been a problem with the technical data flow between Robert Jones and the NWIS data warehousing team. And that's where we get our validated referral to treatment time information from. So just to give you a sense of that, we're still doing some further work to make sure that we are absolutely 100% confident with the reporting, and we'll ensure this is picked up in the Performance and Resources Committee meeting. But our understanding is at the moment that we hold some local key performance information, which is then validated through the national system, is that we currently have 34 people waiting over 52 weeks in Robert Jones Agnes Hunt. And I just wanted to reassure the board that this has been escalated to NWIS for investigation and resolution, and we are also undertaking that work locally to ensure that that's improved. And then the final point, just in terms of the workforce, is to say that we continue to push forward with the workforce measures, and just to highlight, the workforce sickness rate still remains a slight improvement, and work is, that's heartening at the moment, but a really important thing to measure during this period as we go into winter. And also we're continuing work to continue to improve performance in relation to complaints and serious incident compliance. But other than that, Chair, I'm happy for myself and my colleagues to field any questions you may have regarding the report.
Thank you. Any questions? I can't see any questions there, so I'm assuming there aren't any. But maybe Carol Shilleby, would you like to just come in on that?
Yes, thank you very much, Chair. I think inside this report really is the one of the very key challenges for the NHS moving into the beyond the short and into the medium term. And I did refer to it a little earlier about how people can access care and support. So I just thought it might be useful to just give a very short sense of the work that we're doing in order to try to reduce the risk of harm as a result of people not being able to access services in the traditional way. And we will also have some real successes as well in our mechanisms for doing things differently. So a couple of headlines really. One is that clinicians are reviewing waiting lists and looking at the cases that are on that list to identify those who are in the more urgent category and need to be seen. So there's a risk stratification of that. There is the increasing availability of digital consultations, and many more of us now have experienced those. And I would say on the whole, the feedback is extremely positive. Although we know that they're not for everyone, and they wouldn't suit every setting. So important to mention that as well. And then the third element is certainly in relation to our provider. We are working extremely hard to try to ensure that we can see as many people either digitally or face-to-face as we can within the current infection control requirements. And I'm pleased to say that an update that I had last week across a number of the key service areas is indicating that we are managing to sort of eat into some of the backlog of patient numbers and consultations that we would have ordinarily have been dealing with through the summer months. So I just wanted to mention that, but this is a very much an uphill climb, not just for Powys but for Wales and the UK, and I'm sure we will come back to this as a board in terms of discussing how we can catch up on the work that we haven't done so much of over the recent months.
Thank you, Carol. I know time will tell, but it is very difficult, isn't it? Trish, you'd like to come in, and then Julie Rose. So Trish Button first.
Okay, thank you, Chair. Hayley, I don't know if I picked it up incorrectly, but in the paper, it mentioned on the 19th of September, we had a positive rate of COVID of 6.8 per 100,000 people. But in your presentation, did I pick it up correctly that you said 19.6 per 100,000 as of today?
Yes. Yeah, and I must admit, Trish, this changes significantly. It constantly changes on a daily basis because it's a 7-day position. I need to double check. That was the briefing I had first thing this morning, and that is correct, Carol, isn't it? Yes, sorry, I've lost my figures now, Trish, but yeah, it is increasing, which is why I was reinforcing the need for us to, although we're doing well comparatively in Powys in terms of our incident rates to other areas in Wales, we have got to make sure that we maintain those measures and social distancing and reinforcing that messaging, because on that trajectory going up, we may face similar situations to other counties around potentially needing to take additional measures, lockdown measures. So I think it's really important that we're not complacent. We do have the pandemic in Powys, and the figures we're tracking on a daily basis, so it has increased from the date that the report references on the 19th to today to that level.
Will we be communicating that? I mean, how are we going to make our population aware of this change?
Yeah, just to let you know that the Alison Merry, who has called an incident meeting this morning with comms and engagement team representation, because our first point is there's a level of escalation which is 20, so we're at 19.6 at the moment, which takes us to the light amber range. So that's our first line of defence, which is about strengthening the comms and engagement that we can do to try and reinforce the messaging. So that has been held this morning, comprising the relevant sort of personnel within the health board.
Oh, thank you. Yes. Julie.
I just wanted to come in with, I know that Hayley mentioned our staff, and absolutely we recognise the effort of our staff during this difficult period. As a health board, we have focused on our staff wellbeing in partnership, and we have had an absolute focus on ensuring that we support our staff to keep them well. I think that is showing evident in terms of the report that Hayley has presented. So I think we have been very pleased with that area of work within the health board, and recognise the support of our staff.
Yes, thank you. Thank you, Julie. Where would we be without them? I think that brings us then to the end of that agenda item, and we can go on to look at the all-important financial performance report for month 5. So Pete Hopgood, our Director of Finance, could you come in, please?
Yeah, thank you very much, Chair. So you've got the full detailed report included in the agenda pack and the papers. That includes the report and all the full supporting appendices. What I'd like to do is just take us through some of the key points and also give an update in relation to the funding confirmation we've had from Welsh Government that Hayley referred to earlier in her presentation in relation to the operating framework. So if I could take you to page 2 of the finance report. As at month 5, which is the end of August, against our revenue position, the Health Board is £270,000 overspent, but continues to forecast a break-even position at year end. That assumption is based on full funding in relation to direct and indirect costs of COVID, both to date and to the end of the year. In relation to our capital position, we spent £573,000 against our £2.2 million allocation to date, and we currently under pressure in relation to our public sector payment policy target. If I can now take you on to page 9 of the report, this includes our latest capital return in relation to the identified costs in terms of capital in relation to our COVID response. This again relates to an earlier item when we talked about ventilation. So we're currently forecasting a 1.9 million requirement in terms of capital for our COVID response. And as Hayley alluded to, the indication from Welsh Government is that this will be funded. If I can then take us to page 8. Page 8 of the report includes a blended forecast identifying the direct and indirect costs of COVID on our financial position. So just to highlight, the direct costs of COVID would include our additional surge capacity, our additional resource employed in relation to TTP, and also mass vaccinations. Our indirect costs of COVID would include the impact of our block contract arrangements and the cost of not being able to deliver savings. If you look at that blended forecast included on page 8, it identifies our total cost of COVID for direct and indirect costs to month 5 of 5.9 million, and then a range of forecasts between 14.9 million and 23.1 million. The reason there's such a range is, of course, our forecast will depend on the level of surge capacity that we need to provide, the level of the tracing and testing teams capacity we need to provide, and other variables. So it is subject to a level of variability. Now, what I can confirm is that included in the operating framework for quarter 3 and 4, we've had confirmation for Welsh Government of our funding to be received. And this is made up of an element of ring-fenced funding, which is to be managed on a national basis. That will cover the elements that include trace, test and protect, PPE and the mass vaccination. And then we've also got a discretionary allocation of 15.5 million, which is to offset our direct costs in relation to surge capacity and the indirect costs in relation to block contracts, the inability to deliver savings and other items. We're currently working through a full assessment of what that means against our latest forecast. As of reference, there is a level of variability in there, and as you will note from the funding figures I've just mentioned, we're in the range of our forecast. As we develop our quarter 3-4 plans, we will be able to reference this back to the funding available, ensure that we're all aware of what that means and able to make decisions in relation to priorities and other decisions needed to make sure our response is within the funding allocated. So they're really the key points I wanted to pull out. Happy to take any questions.
Thank you. Do we have any questions? Tony Thomas, independent member. Yes, do come in.
Yeah, just a few queries on the report, Pete. In light of the position the UK is facing itself at the moment, we're heading for a recession way above anything in our lifetimes. The amount of money available from London is going to be under huge pressures. That's coupled with Brexit as well. We don't know what that is going to benefit or not benefit the UK. I mean, I understand the position perfectly, but are the Welsh Government guaranteeing that this COVID expenditure will be met, bearing in mind the pressures on the Exchequer in London, and you know, unemployment is going to rise significantly and all the consequential costs for that. I mean, it's not very, I'm painting a very gloomy picture, but I think that's what we're going into financially. So I'm a little bit concerned. I mean, I've got no answer for it, and I don't suppose anybody else has either. I mean, we are where we are with COVID, but there doesn't seem to be a cast iron guarantee that this 5 million or so will be funded. What's the latest news? I suspect all health boards probably in worse position than us over this particular area because of, you know, Powys have been very fortunate so far with COVID. Anyway, that's the question. What guarantee have we got that this money is going to be forthcoming?
So thank you, Tony. I think there's two elements to your question there. So number one, in terms of our level of assurance in relation to the funding to be received from Welsh Government, we've had confirmation of our 15.5 million. It was included in the operating framework for Q3 and 4. So there's high level of confidence in relation to that. And also the indication of the ring-fenced funding to be managed on a national basis in relation to the TTP, Track, Trace, Protect, PPE and the mass vaccination. So we've got that confidence and we've had that confirmation from Welsh Government. In relation to the future, I agree we're facing a lot of uncertainty. In the Health Board, we've already started to think about how we would approach that going forward, what it may mean in terms of any annual planning process for future years. And we've started to look at that. And when we've got a level of detail, we will bring that to the relevant committees and to board to discuss.
Well, thank you, Pete. I don't know, Tony, are you reassured by that?
Well, I hope Pete's optimism comes through. I'm always been known, I don't remember the economist gloomy mouthness. I've always taken his position on things, but I think you'd probably be right, Pete. And, good luck with it, or good luck for us all with it, actually.
Yeah.
Yeah, it's going to need a team effort, and absolutely.
Yeah. Thank you.
Mark Taylor, you have one question.
Yeah, thank you. From I think what you're saying, Pete, it looks relatively good news in terms of the non-ring-fenced element, because it comes within that sort of minimum point of our range. In terms of the ring-fenced element, has that actually covered cost to date, and will it cover costs projected in that table?
Thank you, Mark. Yeah, so when I alluded to that the piece of work that we need to do as a team is to work for exactly what that means. So there's a number of returns that we have to complete on a monthly basis. If you go through the full details of the finance report and all the supporting papers, you will see the detail of those returns. So for each individual area, we're fully linked in as a health board in terms of informing what our forecast costs are. If I take mass vaccination, TTP, so we're fully linked into that. How those funding mechanisms will flow, there's some elements still to be resolved, but the expectation is that will pick up our cost to date and our forecast costs as included in that blended forecast. You are right, it is a reasonable allocation of funding. It is in the middle of our range. Of course, there's a lot of variability in our forecast. The level of, if I just take surge beds, the number of beds we require on a week by week basis over the next 6 months is very hard to predict accurately, and we've got plans around to how we flex up and down that capacity as needed. So there is a lot of variability. What I will say though is everyone's fully cited on our assumptions that underpin our forecast, and we need to carefully monitor them to understand what it means against the funding allocation. But yes, it is a reasonable level of funding, and it is in that range.
Thank you.
Thank you.
Happy with that, Mark? Susan Newcourt next.
Yes, thank you, Chair. My question was, do we have enough funds, well, money's ring-fenced to ensure consistent supply of PPE for our staff? But actually, Pete, I think you've really just given that assurance.
Yeah, so if I in relation to PPE, I think there's a couple of things to mention. I think it's worth just referencing nationally the fantastic work that's been completed by shared services and the procurement teams to secure a good supply of PPE for Wales. That obviously includes ourselves and our partners in the local area. So PPE supply is being managed on a national basis. We're fully linked into that, and as I did reference, the funding in relation to PPE is one of those national ring-fenced areas, so it's covered in that way.
Thank you very much. That's good. Thank you.
Thank you. Well, we note that report, and thank you, Pete, very much.
Thank you.
Now let's move on to Katie, who always waits so patiently while we all give our presentations and ask our questions. Katie, Chief Officer of the Community Health Council, your report, please.
Diolch yn fawr iawn. Thank you, Chair. Just to say, I hope the report is reasonably self-explanatory.
Yes.
I'm going to just pick up a couple of pointers, if that's okay, and updates for board members. Firstly, on page 3, you'll see reference to a survey that we've been undertaking relating to GP access and access to technology and connectivity, which relates to the comments that Carol was making early on. We've not just been using technology to seek these views, so we've used online and hard copies, as well as the usual QR codes and social media, posting on other community groups' social media, which has been really effective. So when I wrote this report, we'd had 574 responses. Yesterday we'd had 697, and today we've had 766. So we've had a significant response to that survey. Just thought it might be helpful just to share a couple of really high headliners that are sort of common, that are coming out, bearing in mind that we haven't yet undertaken the full analysis. Concerns around misdiagnosis and misdiagnosis, frustration around telephone systems, which I don't think is new, wanting and suggesting a specific time for callback, difficulty in expressing the health issue of the individual concerned, and last but not least, and no surprise here in Powys, is internet connectivity and equipment. So we'll obviously be analysing all of those responses. I'm not quite sure when we'll complete that analysis. It's significantly more responses than we have ever had before, which is great. But we will obviously share those responses with yourself and the Welsh Government. The second comment I'd just like to pick up is on page 4, which relates to the Q3 and the Q4 planning. And I'd just like to thank Hayley and her team. She has already mentioned it, but we had a very, very useful, I think it was about 2.5 hours actually, a session with the Executive Committee and with other members going through and feeding into the Q3, Q4 planning. So we've obviously picked up a considerable number of issues over the last 4 months, and it was really a helpful opportunity to feed into that discussion, and obviously embracing new ways of working, but also just the reassurance of how that will be taken forward with regard to engagement and consultation. I've mentioned Haygarth since we last met. Since I wrote my report, the Executive Committee have met. We have had over 140 comments, which is quite significant. So we've undertaken an analysis just to confirm the concerns really that we have at the moment are about process. So I've been in discussions with Jamie, and I think Carol, you and I and Viv and Francis are picking this up in our discussion tomorrow. Finally, some great news for us is that the Minister has agreed to extend Francis's term as chair of Powys CHC, which for me, I'm sure, you know, the commitment and dedication that Francis gives is unquestionable and is great news for Powys CHC. So, Chair, I'm happy to take any questions, but that, I think, summarises it.
Yes, thank you. I mean, it is really good news about Francis. I'm delighted. Are there any other questions then? I don't know, Karen, if you want to pick up on anything. I can see that Ian Phillips has a question, and so does Trish. Would you like to come in before they do, Carol, or will you wait?
I can wait, Chair, if others want to go first, yeah.
Right.
Otherwise, I can pick up at the end, yeah.
Okay, Ian then, please.
Thanks, Chair. I just wondered, it really is a question for Carol, actually, rather than for Katie. And on the surveys, the comment on page 2 about better communication during this time to let people know that they haven't been forgotten. Just wondered if we're picking that up and how we're doing it.
I can pick that up at the end, Chair, if that's okay.
Yes.
I respond awfully. Thank you.
And Trish?
I think my question's more or less the same, but also to thank Katie and Francis and the team for the work that they're doing and the information that they're bringing back to us as critical friends. It's much valued.
Yes. Thank you. I think Jamie's got a comment he'd like to pick up on the survey work. I must say it's very, very helpful for us to be informed by you about these surveys. It really helps us to know where we are and what we can do to make things better. Jamie?
Yeah, thank you, Chair. Yeah, Katie, I noticed that on page 2, and I look forward to that report. I would want to flag up to my colleagues across Wales as well. So I look forward to that and see what it is. I think in every forum I've been involved in, with community as well as professionals across both health and social care, we're very keen to understand some of the challenges during COVID, the positives as well, about how we can work together and do things differently. So again, this will be another source of information that will be invaluable to us, particularly as it was by default from a patient public point of view, as opposed to a professional perspective. So thank you in advance for that work.
Thank you. And Carol?
Yes, thank you. So just a couple of comments from me. So in response to Ian's question and the point on page 2 around being informed about where people are in their care pathway, we did during the first wave of the pandemic establish a telephone line to support people with their appointment issues or getting some advice and support. Whilst we did have a number of calls in the beginning, they did tail off, and so therefore we took the decision to step that down. As I referred to earlier, in terms of our own provider access to services, we are really turning the tap, considerably on. And just to remember that some did not stop. There were a number of services that didn't stop, and they may have changed in the way in which they were delivered, which is why I think I'd concur with others, and the survey results are going to be very interesting indeed. So I'm very happy to follow up on any sort of specifics that come out of the survey, but as you say, Chair, getting that type of feedback is always a useful source of intelligence for us to consider as we move forward. And then just finally from me, yes, I think we're going to discuss the Haygarth developments tomorrow in our meeting. Be very happy to do that. And at the moment, I think I can't recall a period when we've had more contact with the Community Health Council, and so I am assured, not just through your report, Katie, but through our contact point, there is good dialogue of issues and concerns being shared and hopefully being actioned our end. So thank you for that.
Thank you, Carol, and thank you again, Katie. Could we then go on to look at the Corporate Risk Register, September 2020, and I'm calling on Ronnie Mallinson, our Board Secretary, to deal with this item. We are being asked to approve some proposed amendments. So if you start with a review and then explain, Ronnie, where you'd like to go from there.
Of course, thanks, Chair. So this paper presents to the board the corporate risk register as at September. The paper outlines, which I won't go through in detail, an update from the Risk and Assurance Group and the Executive Committee, who have considered any risks that require escalation to the corporate risk register for the board's consideration. We're only escalating one for the board's consideration, which is in relation to the South Powys programme. That's rated as a high risk with a score of 15, and the detail is included within the register and links to the previous item on the board's agenda today. There are no other proposed changes to the corporate risk register other than the escalation of that one risk. So I'm happy to take any questions on that. The second part of the paper is just to provide the board with the COVID-19 risk register, which is in effect the Gold Command's risk register, which outlines the risks that have been identified in relation to the Health Board's response to COVID-19. That register remains under review by the Gold Group weekly and will be updated further to reflect our Q3-4 plans, again previously referred to earlier in the meeting. I'm happy to take any questions.
Any questions for Rani, please? It is very clearly set out, Rani, so thank you for that. Trish?
Sorry, I'll get this right, Chair. I note, understand the reason for escalating South Powys programme, and I note that the delivery and of records management improvement plan and nurse and therapy staffing recruitment retention is included in our other corporate risks. What was the decision about the fire in a PTHB building?
So sorry, I hadn't realised that one was in there. So there was a discussion around fire risk assessments. The fire safety group met towards the end of last week and was reassessing that risk, and that will go back to the executive committee shortly for discussion, and will then go forward if it's agreeable for escalation at that point. So at this stage, there's no escalation to the board, but discussions are ongoing around the management of fire risk assessments.
Okay, thank you.
Thank you.
Carol, would you like to come in?
Yes, if I could just add around the South Powys pathways, clearly we've just had a discussion on that item. Members will therefore be aware of how much work is happening, and hence my expectation is that even when we wrote this risk, more work has been done, and so each week as we go, we would expect to see that risk coming down to a more manageable level. So it's just to be aware of the pace with which we are working at this stage, and we would expect the risk to reduce. Thank you.
Thank you, Carol. Mark Taylor.
Thank you, Chair. It was just a question around the risk-3 nurse and therapy staffing. I see that one was picked up in part in terms of the COVID-19 risk register as well. And if it's not been escalated to board, is there a case that we should escalate that risk in the corporate risk register to a higher rating? Because I think it's been a concern for quite a while. I know it's a very difficult issue to turn around, but unless perhaps we give it more focus and more attention, it may be something that we catch too late and the risk has already happened and crystallised, and we're caught wanting in terms of the future. So it's just a question for me of how we reflect and deal with that, what I would see as an increased risk.
Thanks, Mark. The corporate risk register does include at risk 006 around the Health Board's ability to attract, recruit and retain staff to medical and clinical roles. So it is implicit within that around the challenges we're experiencing around nurse and therapy roles at a corporate level.
Yeah, I think the point I was making is that risk rating hasn't necessarily been increased. So if you look at the risk and you keep it the same, then you're not actually reflecting that increased risk profile that is possibly being demonstrated by it nearly getting to a board escalation. So somewhere that perception of increased risk needs to be reflected and potentially mitigated.
So, sorry, so it's within the COVID register, but it's also escalated to the board through the corporate risk register. So it is within the corporate risk register as an escalated risk.
So the scoring for CR 006 has actually been increased then, is it?
No, it's a 12. So the same mitigation actions are being taken, and the level of likelihood and impact has remained the same. The escalation from the risk and assurance group has been around the at an operational level. So in discussion with the executive committee, the recognition that we'd already identified that as a strategic risk has been identified.
Yeah, so I think the point I'm coming to is, why would it remain at a scoring of 12 if we're perceiving that that risk is actually increasing?
Carol, would you like to come in on that as well? Sorry.
Yeah. Thanks very much. I think just to add to this paper and this discussion, we will be, Mark, in line with the planning that's underway now for the winter protection plan response, be having a deep dive into the risks at this stage, and so we will plan, and we are planning to really take a very close look at whether there should be further escalations or even de-escalations, and the workforce one is one that runs through. So and again, we'll be really testing out whether we have all the mitigating actions that we actually need and can deploy in place. So I think we'll be coming back to this in our October meeting, specifically around this current environment and not just the long term, Mark. It is an important point, you know, and that I think we're testing out something a bit different this time in this report, which is quite interesting in terms of with risk and assurance. This is where strategically and operationally we meet together, and I think it's a useful challenge. And I can see that Julie wants to add a bit to that as well. This has been a very big topic of discussion, the whole workforce element, of course.
Sorry, yes, sorry, I was commenting in the wrong meeting. So just to say, Mark, this is something we've got under review. We're very clear about what our staffing profile looks like for both Flex Up for winter, but more generally. We're monitoring this, we're out for live adverts. And so if we are unable to recruit to those areas, we will be looking and evaluating that risk. However, we have not given up on some of our, in terms of our recruitment areas. And at this moment in time, we remain optimistic that we will be able to fill those vacancies. Obviously, we monitor that on a week-by-week basis within the gold meeting and on a day-by-day basis in relation to the staffing that we have available. So it's not saying that that risk won't go up, but at this moment in time, we have a full complement and we have a number of actions in train to ensure that we fill the gaps and to be ready for the winter process as well.
Well, thank you, Julie. That's elucidated that for me as well. Thank you very much. Trish, you have a question.
I think it's more reinforcing Mark's point. I actually had it down to raise as well. I think it's been helpful for it to have been elucidated through this discussion, but I think we need to be very clear in terms of the report that's come to board that the context, and I don't think that the cover paper actually gave us sufficient context to understand that it is, well, we know it's always under review, but that it's going to be reviewed imminently in light of our current situation. So I look forward to hearing the next iteration. Thank you.
That's really helpful. Thank you, Trish, too. Is everyone content for us to move on? Yeah, thank you. Rani, could I just ask you to introduce the next item as well, and to bring in the various chairs of the committees to give their reports. Thank you.
Of course, thanks, Chair. So this paper presents to the board a summary of a committee activity during July, August and September. So it presents an overview of the activity from the Executive Committee meetings held in August and September, the Audit, Risk and Assurance Committee meeting held in September, and the Experience, Quality and Safety Committee held in July. There have been no meetings held of the Performance and Resource Committee and the Strategy and Planning Committee during the last reporting period, but both committees are due to meet next week on the 6th of October. Can I just draw the board's attention to internal audits review of governance arrangements during the Health Board's initial response to COVID-19. That's attached to the Audit, Risk and Assurance Committee's chair report. Internal audit's findings were largely positive and did identify some areas for learning, which we will consider through the Q3 and 4 planning process, as we've discussed earlier in the meeting. I'm not sure whether if Carol want to come in as chair of the Executive Committee to add anything?
Thanks, Ronnie. Not specifically. I hope the report is reasonably self-explanatory, and you'll be able to see the range of matters that we have considered and the decisions that we have made. And I know a number of these items are being considered in other meetings as well. So nothing specific from me to escalate. Thank you, Ronnie.
Okay, so I don't think there's anything else to escalate at this point, unless Tony as chair of the Audit, Risk and Assurance Committee or Mel as chair of the Experience, Quality and Safety Committee wants to escalate anything to the board.
Yeah, I just wanted to raise a couple of quick points. You've dealt with some of the items I was going to raise anyway. I was going to mention that we were due to meet the new lead of counter fraud in a pre-meeting with members of the committee. That unfortunately was cancelled by them, so hopefully that could be rearranged for our next meeting. We did have to make some very slight amendments to the tracking because of obviously the deadlines can't be met with the current crisis we've got on. I don't want to make any further comment really than that. The one single tender was very straightforward, and I think single tenders are going extremely well in the last 12 months, let's confess. I got no further comments. Thank you.
Thank you.
If I could just follow up really, just to obviously draw the attention of the board that the EQ&S committee isn't working under its normal process because of COVID. The commissioning assurances can't be operated as normal. We understand that, and that's come through, and we've had discussions on how much we can expect going forward. I just highlight it, because it's such a strange period for all of us. And obviously the committee will be meeting tomorrow, so that's all. Thank you, Ronnie.
Okay. Thanks, Chair.
All right, everyone content with that? I think, can we move on to the next item then? That's 310, the assurance reports, unless Carol, you have anything else to say about the joint committees?
Thank you, Chair. No, just in terms of joint committees, hopefully the information provided is reasonably straightforward. And to say that the Welsh Health Specialist Services Committee continues to meet, and you'll see the range of matters that it's been dealing with. I would just like to mention for board members' interest really that the major trauma development and the major trauma centre in Cardiff has now been launched and opened, and that was a decision we took some months ago, last year, in relation to that. So it's always good to see the decisions we make then actually being implemented, and already people from Powys have accessed that new service. So I thought I would just mention that to you. In terms of emergency ambulance services commissioning, there is a real focus and has been a real challenge in terms of the performance of the ambulance service, particularly challenged by the need to ensure staff safety and the time that adds in terms of wearing of PPE, for example, but also actually the activity is now back to the normal levels that we would be used to pre-COVID, and so that is actually adding some challenge. So a lot of discussion at the East Committee around those key matters and how we continue to see improvements and resilience as we move into the winter period.
Thank you, Carol. Partnership arrangements.
Thank you. Just in terms of partnership, and I know that Julie will pick up the next item relating to the trade union partnership, but it's just to say that I think all of the partnerships have met. The Powys Public Services Board met last week, as did the Regional Partnership Board and the Joint Partnership Board the week before. I think it's interesting because attendance at the partnership meetings has been pretty high. I think people are finding the use of digital means actually really helpful in terms of being able to engage in these meetings. We will be, of course, keeping all of these partnership arrangements under review, given the increasing challenges that we have in managing services on a day-to-day basis. So there wasn't anything specific I would draw attention to at this stage that we haven't covered elsewhere in the agenda.
Thank you, Carol. Julie then, Julie Rose, Partnership Forum.
As the board knows, the Partnership Forum is a very proactive advisory group to the board. The report is self-explanatory. I wanted just to raise one point, which is the progression of the All Wales Staff Survey, which we discussed at the Partnership Forum. We have had confirmation that that will be taking place and happening in October. Both the Partnership Forum and I know the board itself welcome that to understand how we can continue to make Powys the fantastic place it is to work. That's all I wanted to say. Okay.
That's a very good point on which to end, actually. Thank you very much, Julie. And is there any other urgent business? We've had no notification of that, so thank you. The meeting will now close. I apologise for the slight overrun. That was because we had some technical difficulties during our coffee break, and it wasn't just the coffee. And could I draw your attention to the AGM, to the meeting on 22nd of October, and the live event again, which will be published on Microsoft Teams. Thank you very much.
Thank you. Bye-bye.
Thank you. Bye.
Bye. Thank you.
Bye.